I think that when you're kind of going from the inpatient to the outpatient side, we're worried about access becomes a much bigger deal than you're probably used to thinking on the inpatient side. We worry about that on discharge, but even getting a first dose, you have to worry about patients being able to get the medication that's the right choice for them in terms of affordability, that sort of thing. So that's a whole layer of complexity that you're not used to. You're also working with a lot less information about the patient in terms of basing recommendations. Sometimes you have a lot less laboratory values. You may not even have a great way of having a good dialogue with the patient necessarily to give recommendations and that sort of thing on the outpatient side. I think dealing with outpatient stewardship, you have concerns that you sometimes get inpatient, but maybe more so on the outpatient side in terms of people being comfortable with infectious disease sites, people being current, people knowing what the most current medications are, and having a great way of disseminating information to that outpatient setting. We've done a great job on the inpatient side of doing treatment guidelines and getting antibiograms in the hands of our providers and kind of getting them on the same page in terms of the right way to treat infections. But I think that we don't necessarily always have a great way of communicating with a very large, disparate group of outpatient practices in terms of kind of getting people on that same page.